All right, so they've opened the renal unit. Problem solved?
Kojo, how can the problem be solved? It's sounding like a broken record. And yesterday I listened to what do you call it, the PRO of the Korle-Bu Teaching Hospital on your station. I then in the evening listened to Dr. Ishmael Yamson. And I'm trying to juxtapose both together, and I'm asking myself, to understand whether the problem has been solved, we need to go to where the problem started from. Where did this problem start from? It originated from a notice that was put up at the renal unit saying that they were going to hike their prices, which resulted in the patient saying they couldn't afford it and they would rather die. That was where it started from. But unbeknown to us, the unit had already been shut for a considerable period of time before that notice went. So the premise is that the patients cannot afford. And then you had a thought leadership program where it was clearly established amongst all of us who were on the panel that nowhere in the world do people pay for renal dialysis from their pocket because it's too expensive and it cannot be afforded. So every time there's some insurance or there's a funding process in place to fund some of these very expensive diseases that unfortunately afflict some members of the population. So that is granted. Then it became established that there was a debt of 4 million Ghana cedis, which had accrued and was owed to the consumable suppliers. And they were refusing to supply. As a result, if it was opened, they would run out of consumables and even inpatients would not get a service. So that's granted. Now, they issue a letter saying it's been opened. And Kojo, if you read the letter, the first thing becomes clear because I've tried to lay out where we started from. The first thing becomes clear. The 4 million cedis hasn't been paid. It says clearly in the letter that the 4 million cedis hasn't been paid. And this is money that the Presidential Advisor on Health promised it was going to be paid when? On the 8th of October. Today is the 8th of November. Then the Minister of Health gave a directive. And then the Minister of State in the Finance Ministry also spoke on the matter last Friday on your station and said that they were going to work through the weekend so that by Monday it's paid. Nothing has happened and this letter has come out. So let's shelve that. If you read the letter properly, you'd realize that it's through the benevolence of others that they are being able to open, but not injection of any money from the government. It's clearly stated in that letter. More importantly, how does any institution accrue a debt? It accrues a debt because it's not breaking even. So if you want to open, there should be modalities in place to fund the place such that the debt buildup stops. So it happens in one of two ways. Either the patients would have to pay an increased tariff. And if you read the letter, I stated in that they are saying that Parliament should expedite the process to approve the new fees. Are we not back to where we started from, where the patients cannot pay? So that letter, Kojo, in it is like a debt warrant. It's a signed debt warrant that I'm reading to you. And that is why I'm saying, where did we start from and where have we gotten to? So in that letter, they are being told that they should increase the tariff. Meanwhile, the patients have told us they cannot pay. So is it that you are opening the unit, Parliament increases the tariff, and they cannot pay, so they will not access it? So the government doesn't pay the debt, and you are not using the consumables, so a funding stream doesn't have to be put in place? That is how I read the letter, Kojo. And that, for me, worries me. It takes me, and that is why I'm trying to juxtapose what Dr. Ishmael Yamson said with what the PRO said, and saying, is this what leadership looks like? So Dr. Ishmael Yamson is right. It seems we don't have leaders in this country. Because if we really had leaders in this country, nobody who was with this problem from the genesis, like I have been, would put out a letter like this, knowing that all the milestones from the genesis have not been dealt with. So, Kojo, that's where I'll start from.
All right. Now, of course, when the letter you refer to is the news release from Korle-Bu Teaching Hospital, with this under the subject "Reopening of Renal Dialysis Services to Outpatients." It's a very short news release, so I'm going to read it. It says, "Management of Korle-Bu Teaching Hospital wishes to inform all stakeholders and the general public that the renal dialysis unit was reopened to outpatients on Monday, November 6, 2023. This was subsequent to engagement with the Minister of Health, Kwame Sarpong Asiedu, last week. The Ministry of Health is working closely with the management of Korle-Bu Teaching Hospital to offset the 4 million Ghana cedi debt occasioned by the cost under recoveries. We call on Parliament to expedite action on the proposed new fees and charges to enable us to recover costs and sustain the service. We commend individuals, corporate bodies, and other philanthropic organizations who have over the years helped us provide life-saving treatment to our patients. It is our hope that other stakeholders and benefactors will also come on board to support in order to prevent a recurrence of the challenges that led to the suspension of dialysis service to outpatients. And then it is issued by management of the hospital with the date Tuesday, November 7. So I walking through this, I see the issues you are raising. First of all, they announced that the place was reopened on Monday. They say this was after they spoke to the minister last week, which is the first red flag for me, because this conversation didn't start last week. The noise and the I don't know what the word is, the campaigning for this place to open started over a month ago. It started from the demonstration when Nasiba made those comments, but it was last week that the health minister engaged Korle-Bu. Then we are told that the ministry is working with Korle-Bu management to offset the 4 million debt. So the debt hasn't been paid, like you said. They are working to offset it. Then they call on Parliament to expedite the charges, and they say that must happen in order for them to recover costs and sustain the service. So until Parliament approves the new fees, they cannot sustain the service. That's the fact that they are putting in this statement. Then they commend those who have contributed and call for more contributions. So I guess the question I have on my mind is this. Looking at how government has handled this matter so far, how much confidence can we have that they will actually do what it takes for this service to be sustained? And I mean all organs of government, including Parliament.
Well, Kojo, the Fantis have a saying. What's it? Wabesha Woma and Kuwembusi. To which it means, if you were going to be given a full glass, you wouldn't have been poured half. So if you look at the track record, and considering that people have been dying as this goes on, we are not talking about maybe running out of salt, where people have food that doesn't taste palatable. We are talking about people dying as this goes on. We are having a life and death conversation, Kojo. Kojo, you are diabetic. You know what it would mean, for example, if a diabetic, say, didn't have insulin, didn't have any medication. That's life and death. So you're having a conversation like that about someone who has a failed kidney or has both kidneys failed, who, without this, could easily pass away. And if you listen to the president of the patients, what did he say? He says there are many. It looks like they cannot be given 2 sessions a week.
It'll be 1.
Yes, another red flag. They require an average of 3 sessions a week. So 2 sessions a week is cutting a thing. If you remember on the thought leadership function, all the doctors on there alluded to that fact. So they are having 2 anyway. And now they are going to have 1 because it's open. So they are going to either have to look for another one elsewhere or another couple elsewhere. Now, the statement clearly says they want to recover cost. In the conversations we've had, it has seemed as if there was going to be a funding stream through the NHIS to bring it on board, but the letter clearly says that they want to recover cost. Another red flag. Then we go to the bigger picture of the conversation. Yes, we are talking about Korle-Bu, but this is a national problem. People across the country are having dialysis. So those silent patients, because they are not in the Korle-Bu catchment, who are also having dialysis, if this is not addressed properly, are still suffering silently. You see, and that is why I use the Fanti proverb there. This is even Korle-Bu. We are not talking about even the regions that do not have renal dialysis facilities. You see, so if you ask me that question, and I ask myself, if this goes to Parliament for upward adjustment of the rates, right? And Parliament also adjusts the rate upwards, knowing that the problem started from inability to pay when Korle-Bu first increased the rate. Would that be a humane solution? That's another red flag. So there's so much going on. You see, this is what we say, the letter is pregnant with crisis. It is very, very pregnant with crisis. And if we allow this letter to be delivered, it most likely will deliver a stillborn outcome. And so for me, the question you asked is met because the government hasn't shown good faith and isn't showing good faith. And until they begin to show good faith, this is not going to be solved.